This is Dr. Daniel Paul with Easy Orthopedics, and in this video I'm going to talk about what is a medical record review. So you may have heard of this before. Some people's job, you may know, may even be medical record review. So what is it? Well, there's two basic types. There's one which is utilization review. That's when a hospital or insurance company wants to make sure that whatever gets ordered or whatever the doctor is ordering is appropriate, and that has to do with reimbursement. When they'll have someone, usually not a doctor, it's usually a nurse, or it can be someone with a high school education, go through and approve or deny services. That's not what I do. That's one type. There's a lot of controversy about it. Doctors will order imaging studies and other sorts of things they deem medically necessary, and the insurance will deny it or retroactively deny it. So that's one type, and that's really a whole industry. Another type of medical record review is more on the medical legal side. So if someone is involved in a car accident or there's some sort of case, they may want a doctor to go and review the person's records to determine, was this injury caused from the accident? Was the care reasonable and necessary? What's the prognosis of this person? How much is his future care going to cost? So that's sort of the medical record review that I'll do. And what it basically entails is me getting an entire record on somebody, and sometimes these can be thousands of pages. Now, I will say that due to most medical record systems, I recently reviewed a chart that was 1,000 pages. And I think of those 1,000 pages, about 3 pages were actually worthwhile. So it's a lot of going through junk, like they document bed rails go up, bed rails go down, bed rails go up, bed rails go down, and that's like 500 pages a lot of times. So it's basically reviewing that, determining if you have enough information to answer the questions that you're given. One issue though is sometimes the medical record, while lengthy, can often be incomplete. At that point, I'll say I can't reasonably do this medical record review, and I'll actually need to see the patient as an independent medical exam so I can get a better story. It just kind of depends on the situation. An interesting note is that a medical record review, like an independent medical exam, is not actually part of the medical files. It's not a medical document. It's classified as a legal document. So if you have someone do one of these for you, you can't really request it. Only the party that paid for it can request it. So that's a little bit of a nuance there. And if you're a doctor, you need to be careful and make sure that your malpractice will cover you in these situations, because some malpractice policies won't. But a lot of them are done all the time for various reasons. I do them myself. And yeah, so I hope that answers your questions about what a medical record review is. If you have any questions, feel free to leave them below and I'll do my best to respond. If you like this video, we put out new videos every week. Please like and subscribe, and thanks for watching.